Welcome to Core Behavior Skills. My name is Carlos and I am a board certified behavior analyst. In this video, we're going to be talking about what is behavior analysis and what it's not, and how it works if you're to seek services, whether it's for a lifestyle improvement or to help someone with special needs or even your own child. The main steps are the same regardless of the service that we provide. Now, behavior analysis. You might be thinking from other videos that you've probably seen or movies, behavior analysis is probably someone who analyzes a person and they're looking at the body language and if they're telling the truth or telling a lie. We don't do that. That's not what behavior analysis is in our field. What we do is behavior modification. We do analyze the person's behavior in the environment, and then we modify that behavior to make an improvement to what their current repertoire is. Now, how does it work? Well, if you go to the doctor, the first thing you have to do on your first visitation before they can do anything is obtain consent. We're the same way. We give you the contract. You read it, you may ask questions, we tell you what the fees are, it's all there, what we can do with your data, what we cannot do with your data. Obviously, we don't share your data, but all of it is there. If you agree and you're okay with it, yes, then we can start going on to step 2. Now, step 2 with us is a bit different from going to the doctor because step 2, it's going to involve a lot of time. And step 2 consists of planning. And planning is technically a discovery phase where we're going to be administering multiple assessments depending on your goals, what's appropriate. And based on what information you give us, we're going to basically be making a roadmap, trying to find out what things we need to modify in the environment or what behaviors we need to modify to make that improvement that we're seeking. Once we have all of that information figured out, then we're still in the planning phase, but now we're gonna be giving you options. Are you gonna take the first option, road A, road B, and road C? Which one of these plans is gonna work best for you? So all of these work, this might be most effective, and this might be the least effective road, but it has to work for you. This is for you, not for your neighbor or for someone else, it's for you. So if you feel comfortable with plan C, then okay, we're gonna start working on plan C because this plan has the modifications that you're looking forward to make that lifestyle improvement. Now that we have that all out of the way, one final component of it is to obtain a second consent from you. Because this is what we're gonna work on. We're gonna be working on with plan C. Then we're gonna go ahead and finally we're gonna get started. Because we got all the planning done, we got it all out of the way, we know how we're gonna collect data, we know how often we're gonna do it, and how often are we gonna implement the plan discussed during the planning phase. We started. Great. That's where we do our intervention and we start modifying that behavior that we're looking forward to modify to make that lifestyle improvement. As we're going along the way on step 3, we're going to be moving from step 3 to step 4. And these 2 steps are connected. Now, oftentimes what happens in behavior modification that when we're working, and even doctors and clinics have the same problem, which is this. You administer the treatment once, and then the person say it didn't work. They administer the second time, and they also say it didn't work. All right, this is the third time I'm taking this treatment. It's not working, doctor. Well, yeah, the fine print for some medications say this may take up to 2 weeks for it to start seeing any changes. And that's something that we have to expect with behavior modification. A 1 day change is not going to have the impact that we're looking forward to. But administering the treatment across time, that's where we're going to start seeing that change. And it all depends on what it is, the goal that we're looking forward to achieving. Some goals might take 6 months, some goals might take years. It all depends on where you're starting from and how long that path to travel is going to take. Any questions thus far?
Can you give an example of a possible implementation?
Sure. So let's say that you're looking forward to reducing alcohol drinking habits. Some people are always at the bar, they're looking forward to reducing alcohol intake. Okay, so what can we do to reduce alcohol intake and hanging out at the bar drinking? Well, with behavior modification, right here when we're in the planning phase, we're going to be talking with the patient on their habits, their lifestyle, what they do, what they see. And a lot of it has to do also with advertisement, something that I like to call marketing itself. You always see something letting you know, come, beer, have a good time, happy. But it's not making you happy because you want to change. So in that case, one of the things that we could add to the environment is telling you to do something else, a different activity. So instead of going drinking at the bar, maybe you could go dancing instead and still have a good time. And that all depends on the person and how they feel and their hobbies, what they are. So it's kind of hard to give like a solid concrete example, but that's an example of a simple behavior modification. We could also have letters in the car saying, go here on Friday to remind you to go somewhere else instead of going to the bar. And again, it all depends. Now, if it's to give another example, someone with special needs, a child that has difficulties communicating in the environment and they don't know what to do, one of the things that we could add for them is we could have picture symbols. And if, for example, let's say the child wants a cookie. Well, how are they going to ask for the cookies if the cookies are all the way up there? Well, we could have him like a little menu and he can just point and indicate that he wants a cookie. And that's a simple behavior modification in the environment to enable that child to communicate instead of him engaging in a temper tantrum. And you're trying to figure out, why is he engaging in a temper tantrum?
What is the typical timeline from consent to let's get started?
So the planning phase could take sometimes 30 to 40 days, depending on the case and what it is. That's what I want to drive. If it's a simple goal, one thing, like for example, you want to modify exercise, you want to be more active. That's one goal. And is that all you want to do? Yes, I just want to increase my exercise. I want to be more active in the community because right now my job doesn't enable me to be active. I'm sitting down all the time. So we know the goal, exercise. We start talking about it. That might take about 2 weeks over here as we talk about it, depending on how much time we have and discovery phase, finding out things in the environment, what can impact you, because probably after work when you get home you are now not in the mood to be exercising. So that happens to a lot of people. So what can we change in the environment to encourage you to go out and exercise, be more active? Once we have that, we just have to like write down a plan for you that will work for you, get your consent again, because this is for you. That's what I want to, drive home. You agree to that plan, we got the second level of consent, then we can get started. And when we get started, if we're doing for lifestyle improvements, you're gonna have basically online consultations. We're gonna follow up with you to make sure that you're implementing those goals, because the starting phases are the most difficult phases there are, because you're changing your routine itself to make that lifestyle improvement that you're looking forward to. If it's for special needs, it's a lot more complicated because we're not talking about one goal. We're talking about a large amount of goals to get to. So obviously, it's going to take more time during the planning phase. And it's multiple assessments. Here at Core Behavior Skills, we do a lot of assessments. So that's why it might take anywhere from 30 to 45 days approximately, depending on the complexity of the case. Any other questions?
How long is how long is it until a behavior modification is considered
Successful?
yes?
So, I need the eraser. Give me 1 second. So, how long until it's considered successful? Right here in the planning phase, we're gonna say we want weight loss as a goal. And you wanna lose 30 pounds. All right, so we discussed during the planning phase the routines, what we're gonna modify, and how we're gonna modify. It might be diet, it might be exercise, it might be a combination of both. It might be learning how to read the label and the package when you're buying, because we don't like to give advice without knowing precisely what choices you're making in the environment or what's available to you, which is another factor to consider. So we know the goal, 30 pounds. You want to lose 30 pounds? Okay, no problem. Now, the next thing we're going to do, part of the package, is that we're going to set realistic goals. This is the ultimate goal. Now we're going to have mini goals. So the first goal is to lose 5 pounds as you go down. So at first, when we're looking at the scale in the graph, your weight might be all the way up here. And then in 2 weeks' time, you could realistically lose 5 pounds without exercising like an animal at the gym, like 4 hours a day, doing an Arnold's, because I did that bump. And, that quick weight drop is not going to last. But 2 weeks, 3 weeks, dropping down 5 pounds, that most likely you're going to keep. You got here, great. You met one part of your goal. Now, your second part of that goal is to maintain that weight. So to not discourage anyone, weight is very complicated and it goes up and down. You want to be consistent on when you're measuring it, and even with consistency, your weight is still gonna do like a little wiggly line. But you want that wiggly line to have this shape. If it looks something like this, you're okay, you're on your way. That's gonna take a long time to lose 30 pounds as safely as possible without working out like a maniac at the gym, pumping that iron, doing 100 squats a day, killing yourself. If you're in a boxing fight, I get it. I mean, you gotta drop that weight. But if you're not, do it safely. And we'll talk about it, how fast you can lose weight also, because age plays a factor. Your gender also plays a factor on how fast you can drop weight. But something that you can visually see how you're making progress across time very important to get you there. Did I answer your question? Okay. Anything else? All right, so that has been the presentation. If you have any questions or comments, please leave them down below and be sure to subscribe.